Hello everyone, myself Tejaswini, Group 7B from 6th year. I am going to represent the topic Scleroderma, also known as systemic sclerosis. Systemic sclerosis is a multisystem collagen vascular disease of unknown etiology, and it is characterized by fibrosis of the skin with involvement of internal organs. Pathophysiology of the scleroderma, vasculopathy of small artery and capillary, and it includes fibrosis. Now, immunological mechanisms such as cell-mediated immunity and humoral immunity. Now, environmental factors which can lead to scleroderma are silica dust, organic solvents, pyogenic amines, urea formaldehyde, polyvinyl chloride, etc. There are two types of scleroderma such as diffuse systemic sclerosis and localized scleroderma. In diffuse cutaneous systemic sclerosis, proximal skin thickening, distal and proximal extremity, and often the trunk and face. It has tendency to rapid progression, rapid onset of disease, early appearance of visceral involvement, poor prognosis. Then limited cutaneous systemic sclerosis. It includes symmetric restrictive fibrosis. It has good prognosis. Graves syndrome. In Graves syndrome, C for calcinosis, R for Raynaud's phenomena, E for esophageal dysfunction, S for sclerodactyly, and T for telangiectasis. Now, localized scleroderma. In morphea, it is a rare skin condition that causes reddish or purplish patches on your skin. The locations are abdomen, chest and back, face, arms and legs. Signs of morphea are hardening and thickening of the skin, loss of hair and sweat glands, linear patches, etc. Now, clinical features of scleroderma are vascular abnormalities such as Raynaud's phenomena and digital ischemic injury. In Raynaud's phenomena, the skin color change from white to blue and blue to red. In skin thickening, basically this is the water in the tissues such as edema, connective tissue matrix, inflammation. In facial changes, we can see pinched nose, pursed lips, cannot even eyelids, lip thinning, retraction, etc. In intestinal involvement, in esophagus, we can see retrosternal pain, reflex esophagitis. In stomach, it is delayed emptying, small intestine, pseudo-obstructions. In large intestine, we can see chronic constipation. Now, gastrointestinal involvement, in that we can see dysphagia, esophagitis with bleeding, Barrett's esophagus, and acute gastric dilatation. Now, small bowel involvement, we can see abdominal cramps, malabsorption, bacterial overgrowth. Colonic involvement, it has constipation, obstipation and pseudo-obstructions. Now, lung involvement, in that we can see 2/3 of the patients are affected, which can lead to mortality and morbidity. And in pathology, we can see interstitial fibrosis and pulmonary hypertension. 10% of heart is involved, in that pericarditis, heart failure, arrhythmia, myocardial fibrosis. Kidney involvement, diffuse scleroderma, proteinuria, abnormal sediment, exothermia, microangiopathic hemolytic anemia, and renal failure. Diagnosis of the scleroderma are ANA, rheumatoid factor, anti-scleroderma 70, DNA topoisomerase 1 antibody, anti-centromere antibody. Prognosis of the scleroderma, it is quite variable and difficult to predict. Major cause of death include renal involvement, cardiac involvement, pulmonary involvement. Mortality in scleroderma, it leads to pulmonary fibrosis, pulmonary arterial hypertension, gastrointestinal dysfunction, various cancers, and scleroderma renal crisis. Goal of treatment, it can prevent internal organ damage, improve the function of the involved organs including the skin. Now, treatment of scleroderma, such as to prevent vascular damage, we can give AC inhibitors. To suppress the autoimmunity and inflammation, we can give azithromycin, cyclophosphamide, methotrexate. And to suppress the fibrosis, we can give D-penicillamine. And now see the management options of the scleroderma. In interstitial lung disease, we can give cyclophosphamide, azithromycin. And in pulmonary arterial hypertension, we can give epoprostenol. In cutaneous involvement, we can give methotrexate. In digital vasculopathy, we can give iliopraz, statins, etc. Thank you for your attention. Thank you so much.